Okay, perfect. Thanks, Melissa. So good morning and welcome. You should have all heard the automated announcement that this meeting is being recorded. The recording will be made available to the public. Therefore, in order to ensure a quality recording, we ask that everyone please mute their microphones at this time and remain muted unless you wish to speak. Also, to assist in making the recording clear, please announce your name each time you begin to speak. So thank you and good morning to everyone. So Melissa, I'll go through now and do our attendance.
Thank you.
So, and Melissa, keep me honest in case I miss someone.
Will do.
So Barbara Cass is here.
Present.
And I am present. Matt Barrett.
I am present.
Judy Dowd.
Present.
Good morning, Judy. Mag Morelli.
Present.
Mairead Painter.
Present.
Michael Morris.
Present.
Morning, Michael. Claudio, I know is here.
Here.
Senator Moore. Representative Amber Crombie. And let me see, Senator Berthel. Representative Case. Senator Daughtry Abrams. Representative Steinberg. Senator Summers. Senator Wong. Representative Pettit. Senator Austin. Representative Walker. Senator Minor. And Representative France. We have two competing legislative committees this morning, so that might be why we don't have folks in attendance. So they might be popping in and out. And then distinguished guests will go through. So Commissioner Gifford. Commissioner Jitani.
Present.
Good morning.
Good morning.
Deputy Commissioner Aaron. Chief of Staff Lita Orfici.
Here.
Good morning, Lita. And Bill Halsey. And anyone who we have missed, could you please announce yourself?
Hi, Larry Santilli and Mike
Morning,
Mosher.
Larry.
Mike Mosher.
And
Good
hi,
morning,
this is
Go ahead, Hillary.
this is Hillary Felton Reed with Robinson and Cole, representing Leading Age.
This is Jonathan Fink with CLA representing Leading Age Connecticut.
Hi, Nicole. Owen Rude from OPM.
Hi, Owen.
Emily Shepard from OFA.
Morning, Emily.
Sue Mosman from OPM.
Sue.
Nick Mazzato, DSS.
Hi, Nick.
Good morning, Betsy Boyva, DSS.
And I think we have, do we have everyone, Melissa?
Hang on, I'm looking. I think so. Yep.
Okay, good. Perfect. All right, thank you. So we will start with a response and update on the COVID-19. So Barbara, would you like to begin?
Sure. Thank you, Nicole. So we are still, we have still maintained our incident command structure at DPH. Lita, Chief of Staff Adelita Orfici is our incident command manager or commander. We are meeting weekly, looking at perhaps a slight uptick as we see a new variant. continue to talk about deployment of vaccine, monitoring nursing homes very closely. Happy to report that we are appreciating a less than, I think it was 5% yesterday, incidence rate of COVID in the state. So collectively, there's still lots of work being done. However, in the facility licensing investigation section, they have, in addition to their participation with COVID, they have resumed their survey activities. I don't anticipate anytime soon that we will stand down our incident command structure. It is still on our radar screen, front and center. So I will stop there unless there are any questions.
So seeing no questions, Mairead, would you like to go next?
Sure. So we are seeing, again, slight cases in nursing home. Things are popping up. However, what we're hearing from residents is they are not, they're not as nervous about this. They feel well supported. They feel they have the information and access to the vaccine if they want it. DPH, Dr. Vivian Lee Young, did reach out to me recently regarding, if there's the possibility of another booster, how they would communicate that with residents. We've had resident councils asking us for information sheets, so received information for them to get out. We think that making sure that residents and family members just have really good access to accurate information from the source, from DPH, is what has helped to this point and what will continue to help moving forward, so that even when we do see a slight uptick, residents and family members are able to live as close to a normal life as possible. So we'll continue to do that. The impacts that we're seeing post-COVID related to the facilities, we're obviously seeing stuff related to staffing and other concerns at this point that we think, sort of carrying forward. We're continuing to watch that and to work with facilities regarding the feedback that we're getting from residents and family members, but that's where we're at right now.
Thank you, Mairead. So from the DSS perspective, I'll provide an update on our response to COVID-19. So as a reminder, and all of this detail is posted to our DSS nursing home webpage. So of course, I'll drop in the chat the direct link to that. So invite folks to check out the website. We try to keep that information posted as much as possible and have actually broken out a separate section of the webpage called Public Health Emergency, where we have most of that detail listed there. As a reminder to the nursing homes that there was the temporary 10% rate increase that was appropriated to the nursing homes that was to last for a 9-month period effective July 1st of 21 to March 31st of 22. In support of nursing homes, the department extended that 10% rate increase to June 30th of this year by utilizing $10 million in ARPA funding. That $10 million will cover the month of June. And then there was an additional funding under Medicaid that will cover the months of April and May. So nursing homes should still see that 10% in their rate. That will continue forward to June. In total, that was over $29 million in support and under that 10% for the nursing home industry. Also in support of the industry, there was $30 million put aside. That's the state and federal share, that $30 million, that $15 million appropriated to DSS to support enhanced healthcare and pension benefits for nursing home employees. Nursing homes were asked to fill out an application to tap into that funding. The applications were to be received by the department by March 25th. We are currently going through all of those applications. We received about $35 million worth of applications. So obviously that's $5 million more than the $30 million that of the pool that we have to work with. So we're going through the applications right now, and we expect that the money distributed, we're going to need to prorate so that we can stay within that $30 million pool. So homes, we're doing a little bit of a back and forth with a couple homes just to clarify some pieces of their applications, but we hope to get that money out shortly and be back in touch with the homes on their amounts shortly. Also, too, as a reminder to the nursing homes, DSS was given 2.5 million in state funding for Medicaid for the fiscal years ending June 30, 22 and June 30, 23 for social work staffing to help support nursing homes in meeting the social work staffing requirement. That money is available. We invite homes to visit the DSS webpage, click on the application, submit their applications to us if they'd like to tap into that pool of money. We've seen about, I'd say about a dozen homes or so come in to tap into that pool of funding. So that money is still available, and would like to remind homes that they can come in for that. Also, direct care rate increase money is available. There's about $500,000 in state funding that was given to the department for fiscal years ending June 30, 22 and 23 to support the minimum nursing home staffing requirement. So we have seen a few homes come in for that, but just like to remind folks that that money is still available, that they can come in for that as well. And Matt, I see you have a question.
No, I was going to wait till you finished your report, Nicole, that I just wanted to comment.
Oh, sure. Yeah, actually, that was about it, because I'll save the April piece for next. So that's what I have, Matt.
Yeah, I just wanted to thank you for recognizing me. And to begin with, you know, I just wanted to comment that we still are getting constant reminders that we are in the middle of this pandemic, and regrettably, it's not in the rearview mirror. And I appreciate Barbara Cass's comment that I guess it's our test positivity rate is, if that's the right metric, is near 5%. But regrettably, at the last reporting, we were showing the highest levels of community transmission of COVID-19. So the coded red in Fairfield County, New Haven County, and New London County. And we had been previously only red in Fairfield County, but we were still reporting substantially high rates across the state prior to that. So I don't know what this week will hold in terms of whether or not the whole state will be red or will maintain where we are right now. And I know public health officials are monitoring the relationship between the community transmission of COVID-19 and the incidence or experience in our Connecticut nursing facilities. And thus far, it's been only incrementally higher, I think, in our nursing facilities, which is extraordinary news. And I do want to comment that I believe that it's a couple of things that explain that. And first, I want to begin with offering great praise to Commissioner Giuttani and Governor Lamont and their leadership. I don't know if anybody's seen Commissioner Giuttani's public service announcements, but they are outstanding in terms of incenting or encouraging the public, and including nursing home employees to get vaccinated, get boosted at the highest levels, and that we are continuing to enjoy the highest levels of vaccination rates among long-term care employees. And it's in part, I think, explained by this leadership, but it's also in part explained by the tough leadership associated with the vaccine mandate, the underlying vaccine mandate, and the booster mandate, which was a hallmark leadership, component of the Governor Lamont's ongoing, strategy here. And I think the early indication is that we're seeing again that in combination with all of the work that our nursing homes and assisted living communities are doing, that the mandate, correlates to higher rates of vaccine and higher rates of booster. And so we're doing well, or holding the line, if you will. And again, we think we need to watch this really, really carefully over the next couple of weeks, and anxious to hear about this week's report. But it's in part explained by our booster rates, in part explained by our willingness to do a mandate. And then two, we are getting better at this. Our employees deserve great praise for the work they're doing. And I think in combination, that explains why we appear to be holding the line. But I think we need to keep our diligence in place. And this latest surge, if you will, on top of the Delta one and the earlier Omicron has contributed to the most significant staffing shortages that this sector has ever experienced, as far as I can tell. And the people that advise me on this matter on my board have been doing this work for some 40 years. So I did want to offer that as an observation right away. And I'm going to have a lot of other additional observations regarding occupancy, and but maybe I should hold on that until you finish your April right sizing report, Nicole.
Thanks, Matt. Mag, I see you have your hand raised.
Yeah, I just wanted to follow up on the numbers for the social workers and the direct care staff. So it's 2.5, you're saying in each year. That's the state funding piece, not with the federal match. So it's 5 and 5. Okay. And the same with the minimum staffing. So
Yes.
okay, great. I just wanted to make sure I was understanding that right. Thanks.
Yeah. No, thank you, Meg. And also too, I forgot to mention that nursing homes in their 7-1 rates, which will be issued July 1st, that there's going to be the 4.5%. So the nursing homes, will be expecting to see that in their rates come forward on July 1st. Commissioner Jitani, I see you have your hand raised.
Sorry, thank you, Nicole. I just wanted to, first of all, thank you, Matt, but also just say that, the booster mandate, we now have nursing home staff even more vaccinated than residents. That's how effective it was in terms of booster, about 90% for staff and about 87% for residents. So kudos to everybody in this industry who helped get us there. And I do think that that's helping in terms of this current surge. What I would say is that for residents that are amenable, getting this second booster will also help in that. And I know that homes are doing that. And I'm glad to hear from Marie that families are asking about it, but most of them got their booster a long time ago, and that could also help through this. So, just something else to continue to encourage particularly in the nursing home for the residents.
Thank you. The opportunity for any other questions before we move on? Matt, I'm assuming that's a legacy hand.
Yes, it is.
Okay, perfect. All right, thank you. So moving on to the April plans. As a reminder to folks, there was a letter issued from the Office of Policy and Management in the Department of Social Services back in May of 2021. That letter outlined additional funding supports to the nursing home industry in return for certain conditions to be met. One of those conditions was that any nursing home that does not reach 85% occupancy by April 1st of 2022 has excess beds in the region or determines that the acuity-based payment system will result in substantial deterioration of the home's financial condition. They were asked to submit to our department by April 1st their plans of how they were going to address or to give the department suggestions, ideas, to be able to just really open up and begin that dialogue of what the industry is seeing and ways that they will address or ways that the department can be of support. So we are currently, at this time, I just want to be clear, we don't have anything to report on directly at this time, but I wanted to add this to our agenda so that we do have this as an ongoing item in our future discussions. The department has received quite a few plans. We are knee deep in going through those and pulling out the information, gathering all that information. We will be developing a large report on what was given to us that we'll be able to share publicly. So we're currently in the middle of developing that report, and we'll be able to report out on that and the findings from those April plans at a future date. So that's the status of where we're just currently at, but I just wanted to let folks know that we'll be putting this on our agenda and get into more detail as we start to kind of have that information to share. So Mag, I see you have your hand raised.
I just wanted to comment that the providers themselves are very eager to see that report and to get feedback. So it'll be interesting to see how this exercise works, because I think there's a lot of interest from the perspective of the field, and they're really eager to hear back and see what the landscape looks like.
Matt?
No, I just also wanted to comment that we appreciate very much Commissioner Gifford moving us in this direction, taking a scan of where we stand in terms of our occupancy and how we're impacted by the case mix and the rebasing of the rates going forward, and an overall view of occupancy in the sector. I do want to continue to just sort of, present a cautionary tone. While I think it's an early signal, and we're anxious to see your report too, well, your findings will be an early signal. They may have a premature component to it, because we really are not on the other side of the pandemic yet. And while I think there's good evidence that we're moving in the right direction, I received a report yesterday that the national occupancy rate is in nursing homes is 73.5% as of last week. But in Connecticut, we're enjoying, if you will, 79.8%, or strike that, 79.18% occupancy. Now, pre-pandemic, I believe we were reporting perhaps 88, 89% occupancy. And we went down, I think, into the low 70s in the worst part of the aftermath of the initial, March, April pandemic. But we're well on our way to recovery, but certainly not to the point where we could consider ourselves recovered. And so where we stand in April is going to be a very important measure, but I just don't think that's the final word on that. And so just want to be cautionary about, perhaps not taking any precipitous or premature actions based on the April report. We may need to wait a little longer, perhaps to the fall, to see where we really stand in terms of our post pandemic recovery. But it gets to the big picture issue that's on our mind, and that's the relationship between occupancy, our staffing levels, the inability to secure staffing and employee worker shortages, and how that informs occupancy. Nursing homes are still reporting an inability to secure staffing to take admissions. And the staffing shortage itself is leading to the most significant increases in costs that we've experienced, really perhaps in a decade, certainly when compared to 2019 levels. And, I don't have to, go past the business section of today's newspaper. Everyone's aware that inflation generally is hovering over 8%. And this article I just showed from the Associated Press shows that over the last 12 months, the price of gasoline has risen 48%. Now, if you're a skilled nursing facility or assisted living community buying oil, not in the hundreds of gallons, but perhaps in the tens of thousands of gallons, these are just enormous costs that are not reflected in the underlying rate setting system. And I always want to pause there and say, as generous and as significant and as much leadership has been shown by Governor Lamont and Commissioner Gifford in this regard, that you so well, enumerated a few moments ago, all the dollars that are available to us. But we are positioned. We say that these recent increases in labor costs are just not keeping pace with the rates that we have received, as generous as we've been. And I know Larry Santilli is on this call. He's quite expert on these numbers, but we're showing enormous increases over the last number of months and over the last year, and especially compared to 2019 in our labor-related costs, and a surge in this agency or temporary nurse agency costs. But Larry, I wanted to get that on the table to see if you wanted to comment regarding these extraordinary cost experiences that we're experiencing that are not reflected in the rates.
Sure, Matt. So we filed, short cost reports for October through January 31st for probably 40% of our homes. And we came out to comparing 2019 pre-COVID to now, our costs going up to 21% for labor. And of course, we're very thankful for the 4.5%. And nobody back then knew this was going to happen. So it's not anything that was not done appropriately by DSS or anybody legislatively. But we are where we're at, and which is the worst shortage we've ever experienced. On top of that, we have pools that have no caps, so they charge whatever they want. Their costs have gone up. What they charge us has gone up over 50%, 54% to be exact. So we even though our rates have gone up 21% our total labor, we still can't get rid of the pool, obviously, because the pool is hiring at a lot higher rate than we have. So that's number one problem. Number two, a lot of the nurses, aides, licensed staff, they've had it with this COVID. And quite frankly, especially nurses, aides, that they're going in other fields, whether it's something a lot simpler to deal with as opposed to dealing with COVID at $19, $20 an hour, when they can go elsewhere, Home Depot or whatever, and get the same pay without the risk that they take. So two things I think have to happen. One, we have to cap the pools. This can't continue. Secondly, our use of pool has gone up to what, Mike, 1,500% over 2019?
The overall cost, yeah, including usage.
The usage.
1,500%.
1,500%. So prior to this, even back in 88, 89, when we had shortages, the pool would come in and just be a temporary help. Now they've basically taken over. We have some homes that have over 1,200 hours of pool use a week. It's just absolutely insane. And I know Matt, you put a bill together. There's a bill somewhere in there for capping the pools. What we're looking at is a recognition of what we're doing now at 21%, and then also capping the pools down. They've got to go down to a reasonable number. So that's our hope, and we've been working with the commissioner's office on that and the governor's office, but we are also be looking at you too. But this is, again, I've never seen it like this. I've never seen a shortage like this. And now with inflation going up to what, 8.5%, Matt, I think 8.3 or whatever, that compounds the problem. So we need relief on that, and we thank very much the revenue relief, the 10%. That because we're at 78%, I think, Nicole, or 79% as an industry as far as our. So we used to be at 89, right? So that 10% comes in handy. I think we're going to still need it because we've got homes that can't take admissions, even though there's a need for that. We just, especially on weekends, a lot of homes are not taking admissions because they don't have the staff. So the current census, although it's going to go up, I wish it was going up a lot quicker than it did. I think we're still going to need relief on that side. So it's relief on the revenue side and relief on the wages side. And obviously I think there's a strike possibly coming up in April. Same deal. There, the union's looking at the inflation and everything else. So we've got to prepare ourselves for that too. So.
No, thanks so much, Larry.
Thank you, Larry. Thank you, Matt. And just a reminder for folks who are not familiar, the occupancy percentages for our state are posted to the DSS website. We do have a section of our website where we post our monthly census reports, and that's as reported directly from the homes to us. So in reference to what Larry was just discussing, our data as of February is showing us at 79% occupancy statewide. The March report I just noticed is not for some reason working, so I'm gonna have to go in and figure that out. But so that will get fixed today. But for February, we're at 79%, and as Matt mentioned, that is better than the national average, which is coming in at about 73%. So I'm not sure who had raised their hand next. So Murray's pointing to Mag. Okay, so Mag.
Thank you, Maureen. I'll be quick. No, I just, all these issues are so important right now because, this committee's got the legislature involved and the administration, and we're working on the budget and facing these issues. And I know workforce is just like, on the top of everybody's priority list. And so, in addition to everything that was already so well said, I just wanted to, I was just wondering if the April plans are indicating any, in your initial review of them, any sort of signaling areas of the state or just how many of these beds are not filled because of the workforce. I mean, I know that several of my members are not filling units, they're not able to staff units. So just wondering I think when we look at those April reports, we really have to cull from them how much of the census issue is related to people not looking for a bed, but how many are also just not being able to be staffed, and how is this impacting, the chain of the healthcare sector? So the hospitals aren't able to discharge. I know it's impacting home health. I know it's impacting other areas of the sector, the long-term care sector and post-acute care sector. But here we have, we might be able to see a really good snapshot and evidence from the field as to what the real impact is. So that, maybe sooner rather than later, if we could just get an idea of what that impact might be, that would be great as we're working on these workforce issues.
Yeah, Mag, I appreciate that question. And of the reports that I have gone through, I haven't gone through every one today. Yes, we have seen that concern pop up in some of the plans that were submitted to us, and our report will report out on that. We're working through them to identify the specific areas that homes have highlighted to the state and areas that they're having questions or concerns or issues with, and I have seen that concern. I can't give you numbers of exactly how many because I haven't gone through all of them yet, but that is something that we will be identifying and rolling up into our larger report that we will give out. Mairead?
Thank you, Nicole. So to Matt's point about occupancy rates, one of the things that we're seeing, and I just wanted to comment on, is related to the appropriateness of admissions. We are seeing some homes, not all, accept admissions for individuals where they may have an initial need for stay, but knowing that they need to be supported regarding their need to be discharged in an appropriate length of time. And that starts on day one, that money follows the person is a discharge option, but that doesn't negate the ability and the responsibility of the nursing home to be actively working with the resident on discharge. We're seeing more cases of involuntary discharges being given and not seeing, someone is accepted, not really anticipating that length of stay and actively working from day one to support that discharge plan. I am concerned with the occupancy rates going up, and in some homes, is that going up because of these admissions that may not be the most appropriate for this setting. So it is something that my office is looking at and will continue to be looking at related to the financial stability. We're also looking at, I think it was Mag's point and maybe Larry's point about the admissions and can they appropriately care for people. We are getting complaints related to residents being admitted and then maybe not having enough staff on at that time to support all of the individuals in the home. And when regional ombudsmen go in, staff are saying, well, we're really overwhelmed. We have a couple admissions tonight, but we had a lot of call outs and we don't have the ability to do everything. And that's very concerning for us as well. So I just wanted to put that out there.
Thank you, Mairead. Matt, assuming that's a legacy hand, or if you had another comment? No, okay. Thank you, Matt. Okay, so moving on, survey activities and quality issues, Barbara.
Thank you, Nicole. I'm just going to signal 3 issues. And the first one that we've had a great deal of discussion on is staffing. We are monitoring staffing across the nursing home industry. We are, as Larry, as Matt, as Mag, Mairead have indicated, are seeing staffing shortages and the implications related to agencies, staffing at the facility level. And it is impacting care. We have partnered with the Long-Term Care Ombudsman's program, and we are sharing weekend visits. We're seeing, in some cases, significant issues on the weekends with staffing. We're seeing units that, and it's not just licensed staff, it's also direct care staff, nursing assistants. So it's something that we're monitoring very closely. We do know at the state level and at the industry level, there is lots of work being done. So we will continue to watch that. We're hoping that we'll have successful outcomes with that body of work that is being conducted right now. We are seeing that the temporary nurse aid program has been supportive to the industry. We are approaching the end of that. So I know there are discussions across government whether or not that will be extended. We have seen and we support the temporary nurse aid program, But more importantly, we want to see the trajectory for that temporary nurse aide. We want to see facilities work with that individual to bring them into a nurse aide curriculum so that we can get them certified. So our nurse aide coordinator at DPH is working with nursing homes. We have seen exponential growth with nursing home or nurse aide programs at the local level, which again, that's what we wanted to see. That's really the point of the nurse aide, temporary nurse aide program. Next, I know we have heard that the department has received strike notice, and I won't go into any great detail other than to indicate that we have received 5 notices. 3 of those facilities are connected to a corporation, and one is a singular facility with a corporation, and then the other is a privately owned nursing home. The department is in active planning. We treat every strike notice as if it will actually happen. And the strike is effective April 22nd at 6 a.m. And as many on this call have heard before, the department's role is really to ensure that there is no disruption to care and services and that care is provided in compliance with state, federal, and local laws and regulations. I know that sounds very bureaucratic, but that truly is the purpose of DPH's role. We will continue to monitor as we have done in the past. So again, an active plan is currently being mobilized at DPH. On the nursing home side, they should be actively, as soon as they got that notice, actualizing or developing their strike contingency plan. We are doing an in-service tomorrow with the 5 facilities to reinforce that. And the strike contingency plan is critical to the overall strike plan. And there is a civil penalty that could be applied should the nursing home or the striking nursing home not provide an adequate plan. So Sunday is the day that we should receive all the plans, and we will look at them and assess compliance with the plan. Last thing I wanted to signal or discuss was this past quarter, we have spent a great deal of time working with a single nursing home in Region 2 in the Wallingford area, which we identified significant quality of care issues with. We had multiple immediate jeopardy situations that were related to neglect, medication administration, infection control, and we had subsequent immediate jeopardies after that. We did a directed plan of correction with the facility, and it was identified during the directed plan of correction in which a temporary manager was directed that significant care issues were being identified. That led to the great potential for compromise of health and safety to the individuals in the nursing home. So we did issue an emergency order to transfer the nursing residents out, and that was successfully done within a 7-day period. And I just want to underscore and reinforce that the action that the department took was an emergency order to transfer residents out. It was not a nursing home closure. So that's an important distinction for us to make at DPH. So I will stop there, Nicole. Thank you. Unless there are any questions.
Okay, seeing none. So Barbara, thank you, because that's a wonderful tie into our next topic. So receiverships, closures, and bankruptcies. So at this time, we have 1 facility that remains in receivership, 0 bankruptcies, and at this time, 0 closures. You can reference again, as a reminder, on our census document. When you go to the monthly census reports, at the bottom of the reports, we list out all the individual facilities that have closed. So you can go and check that out and see that. We also have the bed terminations listed in the census document as well. So for folks interested in tracking that, that's reported out on monthly. So if any questions? Seeing none, moving on to case mix. As a reminder for folks, lots of info again. I think I sound like a broker director sometimes, but we have an entire page dedicated on the DSS website to our transition to acuity reimbursement. So folks are encouraged to check that out if they would like to learn more. And as a reminder regarding the acuity reimbursement, tomorrow we are doing a webinar. It's open to the public. Anybody is invited to attend. It's going to be hosted by our contractor Myers and Stauffer, who has been assisting us in this transition to the acuity reimbursement. Tomorrow's webinar is going to take place at 1 o'clock in the afternoon. And the link and the call-in number and all of that information is available at our website. Myers representatives from Myers and Stauffer will discuss a walkthrough of the entire case mix model. So they're going to bring that up on the screen, walk through the entire model, show you how it works and how it functions. They're also going to give an update on the implementation of the case mix system. So as a reminder, that's going to launch on 7/1. And they're also going to do a review of the shadow rates. If you recall, we implemented shadow rates. It's a document that we give to each of the nursing homes quarterly. It shows them what their rate would be under acuity, how their case mix index fluctuates, and how that then impacts their rates. So this is an opportunity, it was an opportunity for homes to see how their rate will track over time. We have updated that shadow rate document. So we want to be able, during tomorrow's webinar, be able to walk through with the industry. We've mocked up an example of a shadow rate document. So the homes, we're going to walk through it and show how the shadow rate tracks so that homes can really kind of become familiar and understand that report better. And we'll walk through those updates to the document that we have done. So again, folks, the information is posted. Everyone's invited to attend tomorrow, and that's tomorrow at 1 o'clock as a reminder. And if there are any questions on acuity? And seeing none, that takes us to other business. So I opened the floor if anyone has any other topics or items they would like to discuss. And seeing that this was a quiet meeting today. Usually we're a little bit rowdier than this, but okay.
Well, I have to say, I'm glad it's a quiet meeting from the perspective of, the report from DPH, the nursing homes are doing well with the pandemic, and things seem to be working out. We're very, very pleased with the outcomes of the acuity rate system and the way it's being instituted and transitioned. So we really appreciate that phased in process and all of the education and transparency that the department showed. So just want to show our thanks to both DSS and DPH.
Thank you, Mag. Maureen?
And I want to just take a minute to thank both the agencies and the associations for their support. I think since the last meeting, we've really come into a different place regarding visitation and access. And I'm very happy to say we're one of the states that really did very well with that, with getting family members reconnected to loved ones. We had wonderful support from our state agencies, but we also had a lot of support from Matt and Mag, and we're able to recently put out, get out from DPH the essential caregivers policies and procedures, which was incredibly important to residents and family members. And we are one of the few states that have really moved that forward. And I want to make sure that people recognize how important that is and how meaningful that is to the people that we're all here to serve. So thank you very much.
I'll just say one other follow-up to that. I mean, I think that, I would have loved for this virus to just be seasonal, but BA2 is showing us that it's just going to do whatever it wants to do. And the good news is that it does seem to be a milder form of illness for many. But again, our older adults are the people who are going to be the most vulnerable. And yet, even with all of that, vaccinating staff and vaccinating residents is still keeping them generally safe. We've seen with each wave of this virus that we are having less impact in terms of the number of people getting hospitalized, getting infected, and passing away from this virus. So I think if we keep this collaboration, keep the partnership, keep doing the things we're doing, and maybe not be in the same emergency mode that we've had to be, but just keep staying on top of it, hopefully we can, sort of continue to move forward and care for the residents in a way that still acknowledges, like Mairead pointed out, the important things like essential caregivers and visitors, and understanding that balance between needing to have those emotional connections that people need, and at the same time keeping them safe.
Thank you, Commissioner. So if there's no other business or items, I call a motion to adjourn. I don't know if I need to officially do that, Melissa.
Moved. Yes, you do.
Okay, thank you.
You
Melissa
do.
keeps us honest. Okay.
I'm happy to provide a second to Margaret's motion.
Thank you.
Thanks, everybody.
Thank you all.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Oh my God, I can't. I cannot.